Thank you, Ranking Member, and thank you, members of the committee. Thank you for holding a hearing on this important piece of legislation and for the opportunity to speak with you today. My name is Dr. Rachel Cumberbatch. I'm a veterinarian, and I'm here on behalf of the Animal Health Institute, a trade association that represents companies who make animal medicines. I'm here today to ask Congress to reauthorize the Animal Drug User Fee Act, or ADUFA. This program is important to ensure Americans have efficient and flexible regulatory system capable of evaluating innovative solutions to unmet medical needs and to meet the challenges of the future. This legislation is important for the simple reason that keeping animals healthy provides economic and social benefits that touch everyone. In fact, some 70% of U.S. households have at least one pet, and every U.S. household benefits from a safe and available food supply. Animal health products protect the health and welfare of companion animals. These animals improve the mental and physical well-being of their human caretakers, work alongside many of our public servants, and assist with therapy for those in need. The pandemic highlighted the importance of pets when stress and isolation contributed to the prevalence of mental health issues and the need for companionship. Animal health products also protect food-producing animals from diseases that affect food availability and the safety of consumers. These important medicines give veterinarians, producers, and the tools necessary to care for the 9 billion food-producing animals annually. Animal medicines also help farmers operate more sustainably and profitably. Healthy animals are simply more productive. Since animals struggle with disease, they require more resources, and many of them will never produce as much as if they remained disease-free. The ADUFA program is designed to provide supplemental funding to the FDA Center for Veterinary Medicine and to meet agreed-upon performance goals to accomplish the congressional mandate of expediting the review process of drug applications. As we prepare for this reauthorization, we spent time examining the public data available on the program's performance over its nearly 20-year history. It became apparent that a gap has developed between program capacity and performance. Over the life of the program, fees have increased 600%, and staff at CVM have also increased. Yet the Sentinel workload has declined by 12%, and the number of products approved has remained flat. Perhaps most concerning, products are becoming available in the European Union before they are being approved in the United States. And that puts the U.S. animal health industry and U.S. pet owners and farmers at a disadvantage. The compromise agreement before you today takes some immediate steps to close that gap and proposes further collaboration and data collection that will help lead to an improved ADUFA 6. Highlights of this agreement include appropriate funding, program enhancements, a focus on metrics, and financial sustainability. The agreement includes base funding of $33.5 million per year, as well as one-time allowances from carryover. ADUFA fees fund about 1/3 of the new animal drug review budget, which we believe meets the congressional intent that these fees are supplemental. Several technical improvements are also included, such as opportunities for earlier feedback for pre-submission conferences, updating policies and procedures, and importantly, an annual face-to-face meeting between the FDA and industry and able to provide education. We highly value face-to-face interaction. It is necessary when talking about these complex scientific issues and finding solutions to important regulatory decisions. Additionally, some new metrics will be implemented immediately and more will be explored for the future. For example, we will work together to find a way to measure time in agency and time in industry. Under the current process of phased review, it's very difficult to measure that total time to approval. Yet that is the key metric that is going to be a perfect measure to the ADUFA success going forward. Lastly, the agreement provides for a third-party assessment. This is a tool that has been successfully used in other fee programs to identify new efficiencies and develop new metrics. It is going to be a first for the ADUFA program. Mr. Chairman, Ranking Member, we believe this ADUFA agreement sets the program on a more sustainable path. It will continue to provide the agency with resources necessary to maintain the program and will institute enhancements to improve the animal drug approval process. We support this investment because a modern and flexible regulatory program is necessary for innovative solutions to reach veterinarians, producers, and animal owners. Those are the people that need them to help keep their animals healthy and live a longer and more productive lives. We urge the committee to pass this agreement without amendments or modifications. Thank you.